How does a small community attract medical professionals when there's so much competition? Well, that's a question that many rural cities in BC are looking to answer, but many are coming to find it's not easy.
We do know from our physicians that they are feeling quite stretched. There are many demands on their time. In rural communities, family physicians don't just work in their medical clinics, they're also working in emergency departments and delivering babies and seeing patients in long-term care.
The East Kootenay Division of Family Practice was hopeful for a large funding injection from the regional district this year to help with recruitment. But the funding request was denied by the board in December in an 11-4 vote. And although the district has allocated funds to the group in the past, none of the requests have been so large.
Given the pressure we feel on the taxation in our budget, this just wasn't really a good year for us to look at too many things that are outside of our key responsibilities.
The district cited many reasons for not approving the request, including the current economic climate and the results of previous recruitment efforts. But most of all,
the responsibility for recruitment and retention of the medical staff in general, physicians, family physicians included, is the responsibility of Interior Health.
In a statement to CBC News, Interior Health said that recruitment is a partnership and it appreciates any support that communities can provide to help bring new doctors to the region. Meanwhile, the Ministry of Health says it's aware of the challenges to attract doctors to rural communities and is making an effort to do so. Minister Josie Osborne says while there's still much work to do, the province has been hiring doctors, quote, faster than ever. According to the East Kootenay Division of Family Practices, there's about 26 vacancies here in the East Kootenay region, and about 10% of the local population is on the provincial waitlist for a doctor, although that number is likely underreported. According to the Ministry of Health, there are about 1,333 doctors practicing in the Interior Health region, but just 134 of them are here in the East Kootenay. It begs the question if local governments should become more involved to bring doctors in, like that of the community of Colwood on Vancouver Island, which recently opened its own city-run clinic.
Municipal governments do have a role to play in being a partner in that process, but I think they're not the only ones.
It's a conversation she's hopeful to continue to have, but for now, she says it's back to the drawing board. Bullock, CBC News, Cranbrook.